So here we are, thank you. So I'm Sarah and I'm based in the UK, and this part of the workshop we've put together with my colleague Jean Haysmith from New Zealand, because we've got a bit of a practical, another sort of go back to the tables at the back, bit of interaction, and then Jean is going to kind of bring that back together after we've done that exercise. This is Jean's declaration, and mine from where I work at the University of Exeter. I'm partly funded by what's known as a clerk there, as part of the National Institute of Health Research. And I've also done some consultancy work for Susan Mickey and her colleagues around the development of this taxonomy, and that was about three or 4 years ago. So I'm going to just briefly revisit the things that Doreen has already introduced, and just to key us into what we're going to be doing in the practical. So what is behaviour change? And I hope that Doreen has already keyed you into that, and I'll just touch on that again. I'll just revisit the taxonomy and look at what happens in terms of individual people's motivation to change versus external influences. And then we're going to look at some of these change techniques, some of the techniques in this taxonomy that we use as clinicians. And I think many of you will find that you naturally use a number of them already. You're already very good at using them, but you might not know the names, or you might not report them in your notes. And two examples I'll give just to set the scene, and these are ones that we're currently using in the OPAL trial in the UK. And you can look up the OPAL trial if you're interested in that. So what do we mean by behaviour change? So it might be about helping someone to engage in a healthy lifestyle, getting them to change their lifestyle. It might be about helping someone self-manage a chronic condition and changing how they deal with that chronic condition. Or it might be, as we know it, about taking or doing a prescribed treatment. So taking a medication or doing the exercises. And this is what this taxonomy is all about, is creating individual small techniques that can help these behaviour changes. And as we've already heard, Doreen has said about how important motivation is within the individual, their capabilities and their opportunities, but also how much is that affected by external influences. So this is one of the group of behaviour change techniques from the taxonomy, and it's called goal setting and action planning. Now, hands up, who does goal setting with their patients? Yeah. So, you guys know this stuff. So you look at the problem and then you set an outcome goal. So the outcome goal in pelvic floor muscle training might be what? What's the health outcome that women want? To stop leaking. So that's the target goal, the health outcome goal. It might be, as Doreen said, it might be the ability to walk to the park without leaking. So that might be a particular woman's or man's outcome goal. But you also need to think about goal setting for the behaviour that you want. So the behaviour that we want here is that muscle exercise, that muscle contraction. So you can set goals around the training programme. So it might be, can you do 5 repetitions? No, your muscles fatigue too quickly, you can only do 3. Okay, so your behavioural goal might be 3 repetitions. Can you see the difference between a behavioural goal and an outcome goal? So how many people set behavioural goals and outcome goals? Great, brilliant. But do you write it down in that way? That might be something else. And then once you've set your goals, have you got an action plan for each goal? So an if-then plan. So if it's Tuesday morning, I'm going to walk to the park and see whether I can get a bit further before any leakage happens. So checking up on my outcome goal. So then you want to review your goals. You want to review your outcome goal. Is the leakage getting any better? But I also want to review my behaviour goals. Am I doing my exercises? Okay. And then the last one in this group is this behavioural contract, which Doreen has very nicely already explained. And it's quite powerful, and it can be a verbal behavioural contract. I will. You get your patient to tell you back what they're going to do. Or it is this written contract. And I think we all know that if we sign up to something, we're kind of like buying into it, aren't we? And when we've done this exercise, we got the chance, when we do the practical in a minute, to have a go with some of these. And we've got little clips, little sheets with the words that a clinician might say and the words that a patient might say. And you can have a little go role-playing, because you sort of feel a bit silly asking your patient to verbally repeat back, I will do this. Or you feel it's a bit overkill to get them to sign the commitment. But I think it's worth doing. Give it a go. The other one I want to just quickly touch on is about promoting self-efficacy. So self-efficacy is this belief that you have in your ability to do something that is going to be beneficial to your health. And it's the work of Bandura, and I can get some references for you if you like. So basically, it's the ability to have the confidence, it's the fact that you've got the confidence that you're doing the correct muscle contraction, you've got the skill mastery, and you believe that it's going to end up helping you to become dry. Okay? So rehearsing and practicing skills is behaviour change technique number 23 in the taxonomy. You don't need to worry about the numbers, but just to know that getting people to rehearse and practice their skills with you hopefully giving them some feedback is really important for promoting self-efficacy in your patients. So, I'm now going to introduce the practical. So in a moment, I'm going to ask you to go back to your tables, all right? And in the packs at the back, or on the tables, you'll see in the centre a big piece of flip chart paper, and in the middle of that will be a sheet of really large text, and that large text is a fictional extract from a treatment session. Okay, so Jean and I came up with a fictional extract of what might happen in a first session when you consult with someone with their pelvic floor muscle training is the plan of what you're going to be doing. In the pack, on the table, you will see little slips of card in a little envelope. And each slip is a behaviour change technique. So one will be something like goal setting, all right? And what I want you to do is take the highlighter pens that are also on your table and highlight in the large text in the middle of the flip chart what is the behaviour change technique, all right? And then use the marker pen to attach the little label with some blue tack, which is also there, to show which bit of the intervention is which behaviour change technique. Okay? We'll be around there to help you so that you know what you're doing, but it's basically a mapping exercise. So mapping what's in the centre text out to the slips of paper. And there'll be some that you recognise, and there'll be some that you might not recognise. And there's a couple of red herring, they're still change techniques, but they're not there, so they're like little red herrings. And there's going to be prizes at the end. Because that's that's social reward, okay? So the other thing is if you want to do, that's the main exercise, the coding exercise, but there's also a couple of sheets on your in your packs that have yellow highlighting text on them. And those are the little rehearsals, little role plays, where you can pair up with someone and just practice doing one of the behaviour change techniques. So like the example I gave just now about perhaps you might want to see what it's like to tell someone to do the verbally, I agree to what I'm doing. Okay? So we've got a bit of time to do this. So if you want to head back to your tables, and we'll facilitate and make sure you're on track. And we'll leave this slide up if anyone needs to look up and see the instructions.